As a child life specialist, I agree with the American Academy of Pediatrics recommendation that screen time for kids under 2 on a daily basis isn't a great thing for their development. But we do use iPads in the ED sometimes to relieve pain and distress during procedures. And in that case, it actually can be very helpful in those specific situations. One situation that works really well is when we're doing stitches on a young child, because the iPad can sometimes help us engage them in ways that the toys and bubbles and other things we also use can't do and can't necessarily sustain. And sometimes it even allows us to complete the procedure without any sedation or restraint, which is always our goal and what is usually best for the child and family. One scenario that really stands out to me in terms of a time when an iPad worked great when nothing else would was when a family came in following a fire in their apartment. And the mother and her young baby, who was about a year and a few months old, were being treated in our trauma room. And the mom was on the stretcher, very upset and also quite ill, while the baby was in a crib at the front and he was crying and frightened and scared. There were no familiar faces around him and a lot of activity in the room. So I went to him and tried to engage him, and the thing that got his attention the most was the iPad. And pretty soon we had him giggling and laughing and reaching for the iPad and, interacting with the app, to the point that we were actually able to sit him up in the crib, and the nurse was able to insert an IV with just his arm out, very gently, and he didn't even realize it went in because he was so engaged and busy playing with me and what was going on. So it really turned the whole interaction around.